Go.
Everybody good? All right, so this is half of the pelvis. So if we're looking at it, we have two of these, right? They do in the back intersect with the sacrum, right? So half of it is called a coaxa, all right? So I do ask that. That's one thing you have to know. Half of it's a coaxa. If we're looking at it, the big flaring bone is called the ilium. We have the top of the ilium called the iliac crest, all right? We have the front of the iliac crest that comes down to this little point, which again is that little point here, which again for you, if you feel right in the front, that's the point. That is the ASIS, right? You can't tell me ASIS, right? It's the anterior superior iliac spine. If I follow the crest back, the bigger, thicker part here in the back is the PSIS, posterior superior iliac spine. All right? Is there an inferior spine? There is, but I don't really ever test on that. So you just have to know the PSIS and the ASIS. Is there probably an AIIS? Yes. Do you have to know it? No. So this one, ASIS, PSIS, PSIS. All right, the other part of this bone, and there are two other parts of the bone. The top one that comes down here is known as the pubic bone. All right, we can see the pubic bone here. The pubic bone meets the other pubic bone here in the front at the pubic symphysis. All right, pubic symphysis. So on the test, if I only have this, a lot of times I'll go like this and say the part here that meets the other bone, and I'm looking for the pubic symphysis. All right. The third bone that makes up the coaxa is the ischium. All right. The ischium is the part, obviously, you sit on. All right. The ischium has a couple parts they have to know. It has a big hole in it called the obturator foramen. It has the big indentation here called the acetabulum. What's the acetabulum for? That is where the head of the femur goes so we can articulate it to hip. All right, so the femur goes into there. And then we have this thickening of the ischium called the ischial tuberosity. And then we have this little point called the ischial spine. All right? So, big flare is the ilium, ASIS, PSIS, acetabulum, obturator foramen, pubic bone, ischium, ischial tuberosity, which is the thickening, and the ischial spine. And then again, the pubic symphysis where they meet. All right, in terms of the lower extremity then, top bone that I'm holding is the femur. The nice rounded part is the head of the femur. Where it narrows is the neck of the femur. We have two big bumps, there's one, and then a smaller bump. So we have a greater trochanter and a lesser trochanter. If you look on the back, there is a line that runs down the back for muscle attachment. That is called the linea aspera. If I turn around and I'm looking at the front of them, again, we have the flaring just like we did in the humerus. So these are the epicondyles. How do I know medial? Head is always medial, right? So this is the medial epicondyle. This is the lateral epicondyle. If I flip them around on the back, we have these two rounded bumps. These are called condyles. Same thing, if it's on the same side of the head, medial condyle and lateral condyle. If we flip them back around, we have this bone sitting here on the front. That is the kneecap, also known as the patella, right? The patella. We have two bones that make up the leg. They are the tibia and the fibula. The tibia is the bigger, thicker one. The fibula is the thinner one. Tibia is always medial. Fibula is always lateral. So if I'm looking at the tibia, I've got these rounded prominences again that flare out. It'd be nice if they were called epicondyles, but they're not. They're called condyles. Right? So this one then would be the medial condyle of the tibia. This would be the lateral condyle of the tibia. We have a little bump right here in front. That is where the quadricep tendon comes in and attaches. So that is the tibial tuberosity. All right? There's one last thing. If you come down, the bone that makes up your ankle that sticks out there, that little bump, that is called the medial malleolus. All right, medial malleolus. If we look at the fibula, the part up at the knee is the head of the fibula. That's the fibula, and then we just have the lateral malleolus. Okay? There are, remember, bones of the wrist were the carpal bones? So the bones of the ankle are the tarsal bones. All right? You do have to know two names. Number one, the heel. The heel is the calcaneus. All right? Where the tibia articulates at the ankle is known as the talus. So the bone directly underneath the tibia is the talus. If I point to any of these other ones in front, then you'll just tell me they are the tarsals. All right, so tarsals, talus, calcaneus. And then just like in the hand, we had metacarpals, so we have metatarsals that make up the arch of the foot. And then we have phalanges, just like we did in terms of the fingers, or phalanges, the toes of phalanges. We do have a proximal, middle, and distal. Okay, that's it. So this one's not too bad.